I am Professor Jayant Panda. I am Professor of Medicine at SCB Medical College, Cuttack, and Vice Dean of Association of Physicians of India. I spoke today on risk stratification in asymptomatic diabetic, their cardiac imaging and the PROCEED trial. When a person is detected diabetic, it's almost 10 years he faces the decompensation or a raised blood sugar. So, at the time of detection, already microvascular and macrovascular complications they set in. So, it's mandatory that when you diagnose diabetes, you check for the available complications. It can be retinopathy, it can be nephropathy, it can be coronary artery disease, or it can be peripheral vascular disease. So, this stratification will be done by the biomarkers as well as the imaging techniques. We know about the coronary evaluation in the form of ultrasound, carotid media intima thickness, and along with others the Holter monitoring and the CT scan imaging of different vessels and the heart, telling about the calcium score, telling about the related evaluation of coronary risk factors. We know the cardiovascular disease and diabetes are closely associated. So, earlier you detect the CV involvement and the coronary heart disease, you will intervene and our patients can be relieved of the complications and live longer and healthier. So, it is mandatory that when you diagnose diabetes, do a baseline workup to see any atherosclerotic vascular disease or any problem related to heart failure exist in our diabetic. So, a electrocardiogram, a Holter monitoring, an echocardiography and the cardiac imaging along with the markers to detect the cardiac involvement is must. If we do that, we can timely detect the problem and intervene for a better cardiovascular outcome. So, without this, if clinically we presume that our patient is healthy, it may happen that patient can have a morbidity and mortality related to this macrovascular complications. So, every asymptomatic diabetic patient deserves to be evaluated clinically by biomarkers, by cardiac imaging and detected the existing macrovascular complications, which will expedite the process of their treatment and relief from the complications. If we remember this in our day-to-day practice, maybe we can give a healthier life to all our patients. Thank you for the opportunity.